As you can imagine, I'm asked a variety of questions. This goes on every day. Frankly, it's one of the reasons why we've created Breast Cancer Answers. But one of the questions that I'm asked, not at all infrequently, hey, Dr. Harness, after I have lymph nodes removed from my armpit area, hey, what kind of changes can I expect? Well, again, like so many answers, it depends on a variety of things. Number one, if you have just sentinel lymph nodes removed, hopefully the kind of changes you're going to experience in this area should be minimal to none. We like to always take out at least one sentinel node, no more than 4, to get the maximum information that we need. And so if we do that carefully, the chance of lymphedema should be very small. The chance of injuring the sensory nerves in this area should be very small. The chance of obstructing the main lymphatic channel coming out of the arm should also be small. Now, you could then lose a little bit of sensation in this area. And then people ask me things like, well, hey, are my sweat glands going to work normally? And the answer about the sweat glands is they should work normally. Patients always ask me about if we've got an incision there, hey, Dr. Harness, when can I start shaving and what have you, start using deodorant? The answer to those questions are, let it heal up, give it a good week or so to really seal over. It may feel a little rough in here, but you can certainly start shaving and certainly start using deodorant. Now, if you end up having all of the lymph nodes removed, whether you're having a mastectomy or a lumpectomy, the lymph nodes are being removed because they're diseased, and that's called an axillary lymph node dissection, then the kinds of things that you will experience in the armpit area could certainly be different. Often the sensory nerves, the little intercostal brachialis nerves that go through the fatty tissue and lymph nodes in the armpit, have to be cut in order to take out the pathologic lymph nodes. You're going to lose sensation in this area. Again, your sweat glands ought to work just fine. Again, the same thing about the incision, healing up, and when can you use deodorant, when can you shave. Those are pretty much the same, whether it's a sentinel lymph node or a lymph node dissection. Now, when it comes to raising the arm after this kind of surgery, I'm asked that question a lot. In general, most of us want to have a drain removed if you've got one in. Allow yourself a good week to 10 days to heal up. But in the interim, there's certainly no reason why you can't be doing combing your hair. But as far as reaching for the ceiling or walking the wall with your arm, generally we like to have you hold off on things like that until after it drains out, particularly if all of the lymph nodes have been removed. So there are a variety of things that can happen. Hopefully this will sort of give you an overview. If the channel the main channels coming out of the arm, excuse me, are blocked by the lymph node surgery, sometimes you'll get sort of a banjo string effect. That could take a few months for that to clear up. So as you can see, like so many things we do here at Breast Cancer Answers, there are a variety of answers to your questions. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.